Perfect. Alrighty. So my name is Misty Todd. So I am a family medicine physician who does OB. I am employed at Boston Regional Health Center, which is in Sedalia. And so I work in Sedalia. As you can see, Columbia is where I trained. So I did medical school and residency there and stayed on it for faculty for a year. And then I'm actually from Northeast Missouri, which is LaGrange. And so I have always known that I was going to do rural medicine, and I knew that I wanted to do family medicine and OB. And so finding the perfect fit for me was a big deal. I'm a hometown girl, very loyal and loving to my family, and I have a very big family. And so now I'm about 4 hours away from there. And so most of my days, this is my home. So this is where I grew up. Those are my pups. And then I got married to a guy who is from Sedalia. And he also is a family physician. So I traded this view at my parents' house where I grew up for this house and farm where we live in Sedalia. And I show people that because I feel like a lot of times family physicians say, oh, you can't make money, you can't do anything, you just work all the time. And that is untrue. We have about 30 head of cattle and 2 horses and chickens and, run a full farm on the side. And so I just want people to know that no matter what you choose, you have to make a way to make that in a part of your life, because work is not your whole life. So back to the topic. Every morning I wake up and I hit snooze. Like I eventually will work out at some point during the day, because if I don't, I know that my mental health will suffer. So I'm a snoozer. So I tell everyone that. Usually go out and feed the cows in the morning. I call my parents on the way to work. So I'm literally taking you through like a day in my life. So it's my dad and my mom. So we talk on the phone every day. I usually go up to L&D. These are my L&D nurses there in Boswell. I see who's on the floor, what I need to do. Did I have any deliveries last night? Am I rounding on people there? But I also do inpatient. So not only do I go to the hospital every morning to see babies that I've delivered or anyone that may be laboring, I see my regular patients in the hospitals that have heart failure or atrial fib or cellulitis or pneumonia or COVID. So I go to the hospital every morning. And then I drive to clinic. And on the way to clinic, I talk to these ladies. And Dr. Steenberg's in there too, because part of my job is not to do anything with seeing patients. It's about training the next generation of physicians to be able to support rural medicine. And so in the middle picture, I'm in the middle, and then Ellie is my residency coordinator, and Dr. Wodowski with the blonde hair, she is one of my core faculty, and we run the rural training track there in Sedalia. On the right side of the screen, the guy and the tall woman in the yellow, I swear I am not short, they're just tall in comparison. They are faculty from Mizzou that I work with. And so on my drive to clinic, it's about a 25-minute drive, I am calling one of these people. And then the ladies in the bottom left corner, they are Gina is in the orange, she is the residency coordinator for the University of Missouri, and we are partnered with them for our rural training track. So during my drive, as much as I'd like to say, I just kind of sit and do nothing and reflect. Nope, I am calling and talking and working on getting things set up for the day. I arrive to clinic, and this is my clinic crew. So I would say I'm the one in purple, but we're all in purple for this picture. So I roll into clinic usually about 9 o'clock, and I probably have 2 or 3 patients roomed already. My nurses, I have 2 nurses, and then a medical student who's right in the middle. Student Dr. Marshall worked with me this last year. And then I have a nurse practitioner and her nurse. And then we have a x-ray and a lab tech, and then my front desk lady is all with us in that photo. And so they know all of the things that I juggle, and it is not without saying that being able to have a team that understands all the aspects of what I do sets me up for success. So if things are not going well in the hospital in the morning, I text them, I say, hey, I'm running about half an hour late. They will get patients worked up, or they will, draw their labs first. They will do what they need to get people rolling and help me have a successful day. And so it's really important wherever you go, making sure that the people that work with you also understand all the parts of your job that aren't, just in a clinic. Usually I get about 3 pictures a day like this from patients or that I don't know what's going on. And I really rely on relationships that I made in med school. And so while I'm always talking to med students, I always make sure that they get to see this picture. So these are my best friends from medical school. So I'm in the middle. I've got two surgeons in the purple and the blue dress on the right side, and then an OB-GYN and a pediatrician on the left side. And they are my go-to consults. You know, we have professionals that we send people to as actual consults, but sometimes you just need someone to say, hey, what do you think of this rash? Or what do you think of this small bowel obstruction? I'm going to try and keep them out of the hospital. So I am in a rural clinic. I'm the only physician there. So I don't have anyone to say, hey, what do you think of this? So keeping your friends close that you make in med school, because they have different experiences and different learning and different specialties, is really important to help get your patients really good care. This is my office. So I literally have an office in the middle of a hayfield. I teach a lot, so I have a lot of students come through. This is student Dr. Marshall with me. We review, you know, EKGs. And then I usually get real tired at some point. So I am a caffeine junkie, unfortunately. And I drink lots of Diet Pepsi and coffee. Another part of what I do on any typical day is life. And so some of my passions are women's healthcare. So I deliver babies. That's a set of twins that I delivered when I was at Mizzou. And I'm really into advocacy. So I think it's a really important topic, no matter what you're doing, to realize that as much as we want to create change within our sphere of influence, like within our clinics or within our health system, if we really want to make global change, we need to do it through advocacy efforts, because unfortunately, legislators and lawmakers have a lot more influence over healthcare than doctors do. And so I've been to DC and I'm in Jeff City quite often, making sure that the patients I care for get the best care and still have the funding and the insurance coverage to be able to get that. And then this is just like my doing life. So on the far picture in the scrubs is me and my husband, and then those are two of our best friends, like the best man in our wedding and his wife, and that's our godson. And it was in the middle of COVID and we were working all the time and we couldn't make it to their house. So our family and our friends are just so supportive of the things we do and the craziness of our life that they will come and visit us at work sometimes, because our life is not always easy and black and white. And even today, you know, being able to do this lecture, I'm like stepping out of another conference lecture. And so being a family medicine physician, especially with varied interests, which I love, you just have to be able to juggle a lot of things, but it always keeps it interesting. Usually some point of the day, I have a Zoom meeting. It used to be in-person meetings, but now we just do lots of Zoom meetings like this. So this is another big part of my day. And then I see patients. And this is a patient that I had. She's actually the daughter of my lab tech. And she said, Dr. Todd, I just want to be like you when you grow up. And so those kiddos that you deliver and then you take care of and you get to see grow up, you know, make all of the training and the long hours and the nights worth it. And so I just put this in as a little pick me up. This is usually what my nights look like in the summer. I come home, I have a little setup out on my back deck, and I do notes or meetings until who knows what time or whatever I have to get done. My husband's actually like over mowing in the background in a yellow shirt. But we manage lots of things and make life as efficient as possible, but still enjoy the outdoors and the life that we always wanted. I get away by gardening. So he likes to mow and I like to plant flowers that he can mow around. So it's a really great marriage strategy. And then we hunt together too. And so, you know, this is just a quick rundown of all of the things that kind of flow into one day in my life. And now I'm gonna stop sharing and bring it back just to the regular Zoom so I can see y'all. And then I'm just gonna go through questions, thoughts, because it's a fast, and that's what I wanted, was just a quick fast overview, but really, you know, what do you want to know about what I do?
Given that I'm the only student here, I guess I'll just go ahead and talk.
Oh yeah, no, it's fine. So Kelly and I know each other on the outside. So Kelly has known a lot about my life.
I guess my question is how were you able to have a career in family medicine, but then also incorporate that OB/GYN aspect? Is it because you're practicing in a rural area and so you had to pick up on skills, or was it like you did a family medicine and then followed it up with an OB/GYN fellowship? I was just kind of curious about maybe like the logistical aspect of how you got there.
Sure. So all family medicine doctors that are trained in the US have to have exposure to OB training and should be proficient at delivering babies. So all of them.
So
Not
everyone
a lot
is
of them.
I don't know.
Whether or not they want to continue that is up to them and their practice style.
Okay.
I specifically knew that I was going to do OB and I wanted to continue. So I did the same way you have electives in medical school, you'll have electives in residency. So I did them in places that had high acuity, meaning really sick, and a lot of delivery. So I got exposure to a lot. And I heard you talking with Kathy earlier, talking about, do you want to do an OB fellowship and all of those things? So I didn't do OB/GYN for a couple reasons. One is I hate hysterectomies. Like those surgeries are the bread and butter of what they do. They take a long time. They're not very fulfilling for me. And like you don't get a baby at the end of it. So I love C-sections. I do C-sections. And that has a purpose at the end. It has a finite end and is helpful for me and, is good, is a skill that I want to have because where I work, it's not an academic center. I don't have OB just there if things go wrong to call. But I also don't enjoy bladder surgeries. And I enjoy male patients and I enjoy little kiddos and I love my nursing home rounds. And so the part of family medicine that I focus on is, full holistic care. Like I said, I see my own hospice patients, like when they go home, helping them die with dignity. I'm their hospice attending. I have about 8 patients in a nursing home that I round on every 3 months. And anyone that gets admitted to the hospital, I go and see. And so they're mine and I take ownership of that. But what I really enjoy and get the most like personal satisfaction from is my OB patients and delivery, and then getting those kiddos to come back to my clinic and seeing them grow up and doing their well child checks and seeing their sick visits and knowing when, great grandma Gertie died and trying to explain death to a 5-year-old. Those are parts of my job every day. And that's what I get. And so that is why I didn't do OB/GYN. Like, I don't want to be a surgeon. I don't enjoy long OR cases. I appreciate them and I love having colleagues that support me, but that's not what I want to do. And I also want to see the variety of patients.
I mean, like I think I know, we were talking earlier about like what I maybe wanted to go into. And I know I want to go into family medicine, pretty much for all of the reasons that you said and more. But I think the reason I asked about the OB fellowship was because I met some family medicine physicians that were practicing who did a fellowship and were then like, delivering and things like that. So I guess the impression that I got was if I wanted to do any of the surgical aspects of OB, then I would need at least a fellowship. But it sounds like it's not required, or is that?
No, it's not required. It's very specific on where you want to practice.
Okay.
So, for example, the University of Missouri, if you're a family medicine physician, even if you have a fellowship, you cannot do C-sections. It is like a hospital-wide policy. Where I work, it is a credentialing process. Like it's decided per individual. So I had to do so many C-sections with the OBs that I work with. And then they said, she is proficient. And it's all with what your comfort level is. So if there is a complicated case or like a woman who has, there are pregnant people with BMIs of 70. Like if there's a patient that comes in with like that kind of thing, I'm calling up my colleague and I'm saying, hey, Mike, you gonna come in and help scrub with this? Like, I'm gonna need your help. But for routine things, you're not. And it's all about your level of comfort and training and really knowing who's around you. That's a really intimidating question and things to think about when you're still in med school.
Right.
But that's
I'm
more
like, what if I
important.
don't know where I want to go?
Nope.
How do
And then,
I prepare for that?
yeah, so what you do is you do everything you can to make yourself as knowledgeable as you can without a fellowship, and then you can decide. Because I thought about it. I thought about doing a fellowship. I think not being egotistical, but I would have easily gotten in.
What is
But
like,
what it,
sorry, I didn't mean to interrupt you.
oh no, you're fine.
What is like, I guess, the benefit or like the difference with doing a fellowship versus just kind of maybe tailoring your electives to
So
have that kind of experience? Like,
yeah,
I
so
guess
the
what's
family medicine OB fellowships are typically 1 year,
yeah.
and you will spend 5 days a week in the OR and on labor halls, and then have 1 day of clinic somewhere in there, and that is the majority of what you do. So people who do fellowships, they come out with a lot more experience, quite honestly, because it's very focused. I would say their point of care ultrasound skills are much better than mine. So I can do a BPP and I can do, fetal measurements. But if we're looking for things like placenta accretas or we're looking at previas, I'm going to say, I want radiology to look at that. And those people, they're going and making decisions based off what they see, whereas that's not something that I did enough of to be able to call it.
Okay.
I think, they also probably have a lot more like resources of navigating the system in all of medicine. A lot of what we do is trying to work within the system we have, how to get patients insulin they can afford, how to get patients diabetes medicine, like oral medicines they can afford. And so same goes through an OB. How to get patients who have infertility into REI faster, or, just like things that we see as family medicine, maybe 2 or 3 times a year. They're dealing with that like every week for a year. And so that is more helpful. The more times that you do a procedure, the more variations you see. So for example, uterine artery ruptures are like the worst case scenario in a C-section. A woman can bleed out in less than 6 minutes if you don't fix that. And so I've been doing C-sections here as part of my practice for 2 years now. And the first one I saw was 2 weeks ago, and so they're unavoidable. Like sometimes babies are just big and they rip the uterus on the way out and the arteries go with it. However, if you're doing a fellowship and you're in the OR and you're delivering babies for 6 days a week, like you're going to probably see that more often.
I guess like right now, after, having been in the field and like having X number of years under your belt, do you ever wish like, oh, I wish I had done the fellowship, or do you feel content with kind of the elective exposure that you had?
No,
like if you could go back, I guess, what would you do?
I think it's a very personal question. So like I would have loved to have done it and had the time, but I think it's really important that why I showed you so many pictures about actual life is like medicine should be part of your life and not your whole life. And so, at the time, my husband's a year behind me in training. We went to separate medical schools. We had been apart for we'd been apart for 4 years, lived together for 1, or lived together for 2. And then if I left for a fellowship, we would have been in separate towns again for a year. It's really hard. Like our parents were sickly and we were helping take care of family stuff. And then when we decided where we were going to work, like that was a big influence. It was like, I'm going to do OB and I'm going to find a system that supports that. And if they don't, I'm just not going to work there. Like, I'm just not. And so, I wish that I would have had the time, but I don't wish I would have done the fellowship. Does that make sense? Yeah. Like, it wasn't the right decision for me. I found people like my OB-GYN colleagues. I have 3 that I work with. They'll call me in for cases and they, are the ones that trained me in surgical OB. And so they're very supportive and like, hey, do you want to come in for this? And there was a while where I was like, call me for every section. And so if they had a patient that was going to C-section at 3 a.m., they'd call me, even if I wasn't on call. But now I'm confident enough in my skills. I'm like, let me sleep. I'm on call tomorrow, And so really your colleagues make or break it. But if there's a system that you're looking in that doesn't support that, it's probably not going to be the place for you anyway.
Sure. Do you think that you practicing more under the scope of like rural medicine has kind of helped you to have more freedom with like forming your career? Or do you think it's more of like that can happen regardless of where you end up?
I think it can happen regardless of where you end up. You just have to show the need.
Okay.
So, for example, if you wanted to do, I don't know anything about you, my dear.
Yeah.
Where are you from?
Yeah.
Like, help me know some about you.
Things. Sure. My name's Monisha. Let me start there. I'm a first generation immigrant from India. So I was actually born there and then I moved here when I was young.
Where?
In southern India. I don't know how.
Yeah, but like where?
Like
I'm
Tamil
real
Nadu?
familiar.
Okay.
So I've spent over the last 10 years, I've been to Nepal probably 6 times. And
cool.
I speak Hindi about enough to speak some like inappropriate song lyrics that I will not do right now.
Very cool. I actually don't know any Hindi, so you're better than me.
Oh,
I speak a different language. But that's really cool. Wow. Yeah. So I'm like from South India. I grew up in the Midwest. So I go to school in Kansas City, Missouri, but I grew up in Iowa, which like really isn't that far from Missouri. Sure. But I grew up in the Midwest. I am like really interested so I'm very interested in family medicine, but my other more specific niche type of interests are with global health. And I did a lot of work with immigrant/refugee populations when I did my master's. So I also have a master's in public health, and specifically in community and behavioral health, which is like a great degree for family medicine practice, but it's completely useless in medical school. But that's just kind of my background, I guess. But yeah, like the thing that really drew me to family medicine was kind of like the continuity of care aspect that you talked about. There was one doctor that I shadowed one time where I just like had like an epiphany type of moment, because this is a doctor that was like probably on her way out, about to retire, but was still kind of doing part-time to stay as long as she could. And one of the patients she saw was like, the patient themselves was a girl, like a small girl for like a well child type of thing. And that physician had delivered the patient and the patient's mother. So like she knew like 3 generations of the same family. And I just was like, oh my God, that's amazing. I want that. I want to know about little Johnny's soccer game over the weekend. Like, that's what I want. So that was just like, that was like my moment of like, yes, this is where I belong. I'm also.
You need to run for MAFP student director. You're crushing it. You've got all the family med vibe. You need to go.
Did that happen already?
No, it happens June 10th. This is
June.
So Dr. Todd was the reason that I ran for that position. So I think now the tide is turning, and I would love to influence you to run for that. You would be wonderful.
I would be happy to run.
No.
Send me your email and I'll make sure you know about it.
Okay, sounds good. I can do that.
I'm part of, what year are you, Manisa?
So right now I'm technically on a gap year, but I finished my first 2 years. So I guess that makes me like a 3rd year medical student.
Okay. So what are you doing this year?
Well, so I had a not so great time with taking boards, which happens, I guess. I'm not happy about it, but it is what it is. So now I'm studying to retake boards.
Good. Good for you.
So yeah, that's what's happening right now.
And
actually, now that you mentioned, or you were mentioning about like newborns and stuff, in addition to studying for boards, I've been kind of part-time working as a newborn hearing screener. I don't know if you've ever heard
an
of
awesome
that.
skill.
Yeah,
yeah,
but it's been like really fun, and I get to hang out with babies all the time, and that's why I'm like, oh man, I think I have to like add OB in somehow. Hence why I was like, when I saw your like job description, I was like, I need to meet her. How do I become her?
So that is what I was going to
ask
tell
myself
you.
that every day.
Oh my God, Kelly, stop it. So
I think I might be following in her footsteps, though.
What I was getting to is family medicine is all about, lifting those up around you. Yeah. So I'm here, and I'm sure it seems very like, oh my God, how did she do all of that stuff? But it is because I had kick-ass mentors that brought me along. And Kelly has benefited from some of the same people because we were both at Mizzou. But really, you just have to find people that do what you want to do and say, how do you get there? How do you do that? So I reached out to Kelly and was like, hey, you need to do this. And she did it, and a whole bunch of other awesome take over the world things. And she's going to be a kick-ass family medicine doctor. But really, joining organizations like the MAFP and coming to these things, you just got a one-on-one like life mentoring that like people at bigger schools and places that don't have MAFP, like they pay for this, like, and that's crazy because family medicine docs, we're really good at giving away our time for free, which is bad, and we are advocating against that. However, in picking other people up who want to make a difference in the world, that's what we do. And so, reach out if you have questions. I think it's really easy when you're at one medical school to only be able to see like the people in that bubble.
For sure.
And that they follow like a certain path, and this is how things have to be. The reality of it is that there are, probably, I don't know, I would hate to put a number. There's probably like 150, 200 other family medicine docs that do deliveries in the state of Missouri, and no one's practice looks like mine. And my practice doesn't look like theirs. And everyone has their own little twist on it. If you want to stay in academics and do OB, I did that for a year at Mizzou, where I shared call with 13 other people. And like when you were on, and when you're off, you're off. Kelly's headed to St. Louis for residency. I don't even know what it looks like there. But I'm sure it is a large call pool with people sharing, but still trying to come in for their own deliveries. And so it's just really making it what you want, finding people that do what you think you want to do. And then along the way, being okay to say, nope, this actually isn't what I want to do. Like I'm living what I thought I wanted, and it's not okay. So like realigning that agenda and changing it is always an acceptable answer.
Sure. Yeah. I mean, I have been lucky enough that I've been able to kind of take advantage of some of the opportunities with MAFP. So like I am very grateful for the smaller, more accessible aspect of the organization for sure. And like I actually, I was one of the students that did the summer externship. I don't know how familiar you are with that, but
I judged all of the acceptance letters this year. Very familiar.
Wow, mine was a couple years ago. But anyways, that's kind of where I had heard about this whole family med and then an OB fellowship, as opposed to doing an OB residency like from the jump. So that's kind of where I started thinking about those options, I guess, of how to combine two things that I was interested in without losing the diversity of like your patient demographic. So I'm glad to hear that it's like being confirmed and that I don't have to do a fellowship if I don't want to.
You don't have to. You just got to find a good place to work. I've been in school
for a very long time, and I think I'm just ready to not do it more.
To not be in school?
Yeah. So I'm like, oh, if I don't have to do a fellowship, then maybe I won't do one.
No, but make sure that when you set up your, third and fourth year electives in med school, as well as in residency, you make sure that you're getting, time with MFM, like maternal fetal medicine, that you're getting time with surgical OB, that you're doing rotations with other people that do surgical OB and like even, just badge deliveries. That way you get the experience and you can say, oh, medicine's all
For
about
sure.
pattern recognition. And so the sooner we pick up on patterns, the easier we're able to help take better care of patients.
And like for my class, our whole reproductive block occurred at peak pandemic era. So we didn't even get the anatomy lab experience of that. So I technically like haven't seen a uterus on a cadaver. But thankfully, because of the internship that I did over the summer, I got to see some like C-sections and deliveries.
Yeah. Who are you with?
Oh man, I was with.
It's okay. What town?
It was in Kansas City. I was at Research and Medical.
Yeah, you probably stayed with one of those. Yeah, they're good.
Like I know some doctors that I worked with. I don't know if that's what you were asking.
Yeah. No, I just wanted to make sure that they like got you in with someone. Yes. It sounds like they aligned you with people that wanted to do what you do.
Yeah. And that's because like when I like wrote my application and stuff, I think I had specified that for me right now, like I know family medicine is what I want to go into, but I'm more trying to understand just kind of the breadth of scope of practice.
Yeah. So family medicine, you can literally do anything.
Right. Which people say that, and I get that like intuitively, but I think it's hard for me to visualize. So it's why I'm like, just show me whatever you have.
Yeah.
Everything.
Let me tell you just a little bit about what my husband does.
Okay.
So we trained at the same place. We went to different medical schools. He went to AT Still. I went to Mizzou. We both went to Mizzou for residency. He does not enjoy OB, but he is like great at comforting families and patients at the end of life. So he's medical director for a nursing home. Cool. And then rounds it to others. And so he also does inpatient, and he does newborn care. So he'll do circumcisions and frenotomies, but he doesn't want to do the delivery. Okay. So his typical day is like, wake up, do chores with me on the farm, go to the hospital, round on your patients. Clinic starts at 9. Sees patients in clinic from 9 until noon. One afternoon a week, he goes and rounds at the nursing home, or he'll do home visits on hospice patients, or, whatever. And then every other day he's in clinic. So he wants to do like a clinic-based practice, but also does inpatient. He'll take care of babies, but he doesn't want to be woken up at 3 a.m. when it's time to start pushing. Like that's the difference in like what is passionate about us. And Kelly's giggling because like Matt has made it very clear that like he doesn't want to do a B, and like that's what gets my gears going. I'm like, okay, time to go. I'm popping out of bed now. So he does that, and then one of my residency partners who also practices with us. Like I literally brought all my friends with me to practice. So there are 5 of us that came. Another one, she doesn't do inpatient. She only will see newborns. So Dr. Wadowski, she does mainly clinic. And her practice is that she's the first one at the clinic per day. So her clinic starts at 7:30. That way patients can come in for lab draws and allergy shots and everything, because the rest of everyone in her clinic does inpatient. So she's like the stronghold of the clinic. And then the other half of the time, she's getting her master's of business administration. So she's like clinic, but also like advocacy and business minded. And then we've got a couple people in our call group who still do ER care. So like their family medicine clinics, and then like 4 days a month, they'll cover ER shifts on the weekends. And I did that in residency. Like I moonlit at rural ERs. Or urgent cares. And so really you can do it. We've got tons of friends that did sports fellowships that are like, oh, I like to, whatever sports. I still cover high school football games. I don't have a sports fellowship. Honestly, if I can't figure it out on the sidelines, it doesn't matter how much training I have. Like we need imaging anyway. Like, and that's how I think of it. As long as I know basic diagnosis can stabilize and then get them to a place they need to be, order imaging, follow up, and then get them in with whoever, like that's a great service. So, I don't want to be the type of doctor that has to follow my own, like, collegiate level athletes. Like that's what family medicine with sports fellowships do. I have no desire to do that. But I definitely am well trained enough that high school football games, I feel completely confident, covering most any injury that can happen on the field. The other one is like geriatrics and palliative care. There are people that do fellowships in that. So in my class, 3 of my
Yeah, that's another
classmates did
area of interest, I guess. Because
Yeah.
I used to be a hospice volunteer in college.
Great. That's
So,
awesome.
yeah.
Yeah, so
I
like
feel
my
like I'm
husband didn't do a fellowship.
I feel like I sound really good on paper, but then I'm like in practice, I'm like, I don't know what I'm doing.
And that's okay.
But,
That's the great part of family medicine. My husband's the nursing home director of a place and rounds it too. And I rounded a nursing home. Like, I didn't do a geriatric fellowship. I didn't do a palliative care fellowship. Definitely would know more if I did. But then again, I showed you the picture of learning, of like keeping in touch with your friends from med school. My friends from residency, like there's 4 of us that had the same clinic. And so 2 went into geriatrics and palliative care, and 1's in addiction medicine. So like and I do OB. So like our group chat never ends. Like it's always like learning from each other and like, what do I do with this? Or like, I'm like, gosh, dang it. Like my pregnant lady on Suboxone is still complaining of pain and like she fell off the wagon. How do I get her back? Like, yes, there is you need to be able to research and you need to be able to figure it out. But having in your toolbox about like a box of tools, aka all of your friends and people that that do things that are different than you is so wonderful to be able to get patients access to care.
For sure.
Without them having to drive, even if it's in the city, like across the city, if the bus doesn't go there, like how are they going to get there?
Right.
In our case, there's just no public transportation in rural America. So.
Right.
Me or nothing.
Makes sense. That makes sense. Wow.
Any final questions? Kelly, anything to add? Kelly's got great perspective. She's been around, done a lot of things.
I would just say, like, as a 4th year, kind of looking back, like Dr. Todd said, find people. And I mean, that's how I've gotten where where I am. I just latch on to people. I like joke that I force myself upon them. And then I'm like, okay, you're my mentor now. You're my friend now. And I try to help them and they help me. And I just try to learn from whatever opportunity I get. And just put yourself out there and go for it. I think Dr. Todd like pretty much gave me a very similar speech in my first year of medical school. And I'm so glad she did, because I started out medical school pretty timid. And now I'm like a ferocious beast. Like, I'm like, I will not like back down. And I just am a huge advocate now. And I wouldn't have been that way if I wouldn't have seen people like Dr. Todd and Dr. Morris at the zoo just standing up for their patients and their students, and just go for it. Just put yourself out there. If you want to do it, make it happen. It might be hard, but it'll be worth it.
Sure.
Yeah.
That's great.
That is great.
So does this mean I can form myself on you, Dr. Todd? Is that what this means? Okay, great. I just assumed that was going to happen, but I figured I should maybe ask.
Sure. I'm gonna put my email in the chat.
That would be great. And could I have your email too, Kelly, just in case I can't find it? But wow, thank you so much for taking time out of your conference to talk to me. You're welcome. I feel
this
so
is
special.
Like evidence. You are so special, but this is evidence of like, if you don't know what you're doing, if you don't have something or you don't want to do something, like literally, Kelly mentioned Dr. Morris and myself and about 4 other people at the University of Missouri and at Boswell, my hospital, were literally starting a residency. And so there wasn't one, and there was a need. There were people who wanted to do it, so we're just doing it. Like, did it, done. Actually, we have 2 patients, or 2 4th years that matched, and we'll be starting with this July 1st. So like, I never thought I would be doing this ever, but here I am, and I love it. So just say yes to opportunities, especially even though I know that you're supposed to be studying and probably feel like that's all that you can allow yourself to do. No, go do other opportunities, find fun stuff, make sure you remember why you went into medicine, and that community behavioral health master's is going to come in big time, because that is what like 99% of my clinic is figuring out how to get people medicine, figuring out what motivates them, how to get them resources, how to get them.
That's why I'm saying, I'm like, I know this is useful. I know I have a skill set that I can use, just not right now.
Yep. No, put it in your toolbox. It's going to be invaluable later.
For sure. Yeah.
And
so
thank you
much.
for being so patient as we like worked out all the technical
Yeah,
difficulties. And
Of course.
MAFP can be small sometimes, but it's very mighty, and the connections that you make just really can last a lifetime. So
For sure.
hopefully you'll
believe
keep
that.
coming back.
Yeah, I hope so
Yeah.
too. I mean, if I end up being whatever director and whatnot that I'm apparently supposed to apply for, then maybe you'll be seeing more of me than you asked for.
No such thing.
Well, thank you. I appreciate it.
You're welcome. Well, ladies, I'm going to go back to breakfast because it is 2 hours ahead here. And I'm going to try and catch another conference. But if you have any questions, let me know. Kelly knows this, but I tell everyone, give me a little bit of grace on emails. I hate email, so I should respond
all
within a
good.
week.
No worries. Thank you so much. Thank you both.
You're welcome. Take care. Bye.